Dr. Juno Thomas, the head of the Center for Enteric Diseases at the National Institution of Communicable Diseases, joins us this morning to talk about the increasing number of people infected by the Listeria outbreak in South Africa. The Department of Health confirmed 748 cases of listeriosis and says that the disease claimed 67 lives so far. The World Health Organization recently said that outbreak in South Africa is the worst recorded in human history. All right, let's talk about this because it's a real concern. Dr. Thomas, thanks for being with us and welcome to Morning Live.
Good morning.
We need to be worried. We need to be concerned. Obviously, we don't need to run around panicking, but what is it that we need to be aware of when it comes to listeriosis?
So I think what it is important to keep in mind is that most otherwise healthy people, if they eat food that is contaminated with listeria, which is how humans get infected, don't generally become ill. It's people in specific high-risk groups that are vulnerable to developing severe illness.
When we talk high group, I know it's the elderly, pregnant women, young children. And people that are sick. Is that correct?
So pregnant women seem to be at the greatest risk.
Okay.
And as you mentioned, elderly over the age of 65, very young babies under the age of a month, but they usually acquire infection when they're fetuses and the mother becomes infected during pregnancy.
Right.
The other important risk group in our current outbreak is people that are otherwise immunocompromised. In other words, they have weakened immune systems. Particularly, we're finding due to HIV, underlying cancer, diabetes, and then kidney and liver disease.
I mean, when you've got the World Health Organization saying that this outbreak in South Africa is the worst recorded in human history, what has led to this? Why has there suddenly been this increase?
So it's the first large outbreak that we've had in the country.
Yeah.
In the 1970s, there was a small outbreak involving 14 people in Johannesburg, which was investigated, but the source of the outbreak was never discovered. However, it seemed to just disappear of its own.
Yeah.
So internationally, listeria outbreaks are increasingly common, even in countries where they have extremely stringent food safety regulations and where they have capacity to do rapid investigation and response. In our case now, what we strongly suspect, based on the pattern of cases as well as the specialized genetic testing we've done on the listerias, is that there is a common food item that is distributed nationally, that many people have access to in the retail sector, that's affecting both people that access private as well as public healthcare sectors. So we're dealing with a contaminated food item that's unfortunately very widely distributed and that many people have access to and many people are consuming.
What is it? I mean, can we find the source of what this is? Or could it be anything that is just not cleaned properly or unhygienic? I mean, do we know the source of it?
So at the moment, we don't know the source. The difficulty with listeria outbreaks in general, and this is not just our experience with the current outbreak, but experience of many countries worldwide that have had similar problems, is that listeria can contaminate a huge variety of food types, from meat and meat products, dairy products, fresh and frozen fruits and vegetables and sprouts, and ready-to-eat products. So that basically encompasses
everything. I mean, that doesn't narrow
types.
Anything down.
Precisely.
But how do I prevent myself from getting this? I mean, if I go to a shop and I buy meat and I cook it, does that get rid of listeriosis?
So at the moment, whilst we really are investigating to narrow down the type of food that's most likely implicated, what everyone needs to do is just practice common sense food safety.
Okay.
And the World Health Organization has a set of 5 food commandments, and they're called the 5 keys to safer food.
Yeah.
It's washing your hands thoroughly before preparing food and regularly during preparing food, especially if you're going to be using different food items.
Yeah.
Making sure that you keep raw and cooked foods separate.
Okay.
So this is important for meat and poultry and seafood. Then that you cook foods adequately. You've mentioned cooking. It's very effective at killing Listeria.
Okay.
So make sure that meat, poultry, seafood, eggs are well cooked.
So just try and stay away from uncooked foods is what you're saying?
Yes, and if you are consuming vegetables and fruit that otherwise you wouldn't cook, make sure that you're washing them thoroughly with clean water.
I mean, we all eat at restaurants. We're all going out, and that is a big concern as well. I mean, you worry that perhaps the food hasn't been cleaned properly. And how do you protect yourself in a situation like that?
So, I mean, it's important to remember that with Listeriosis outbreaks, most of them are due to food that's widely distributed and sold and eaten at home.
Okay.
So obviously if restaurants are sourcing the same food, you are at risk. But we suspect from the cases that we've done in-depth interviews that this is more likely a food item that's bought and eaten at home.
Okay. Dr. Thomas, sorry, I have to wrap this interview now, but I cannot not tell our viewers what to look out for. Can you give me just a few symptoms if perhaps you're not feeling so well?
Okay. So the most common form of disease is a simple fever with diarrhea that in fact most people will just shrug off in a few days.
Yeah, I was telling you I'm not feeling so good today, so
precisely.
I'm counting the symptoms. Let's go. I haven't got the fever, which is good.
No. So and in fact that's if healthy people develop Listeria, that's generally what they develop. The risk groups I mentioned earlier, they develop more severe disease when the bacteria enters the bloodstream and causes infection throughout the body, or travels to the brain, causes infection in the brain, which is meningitis, and those present with fever and the patient feels very rapidly extremely ill. So, you know, those people would ordinarily see a healthcare practitioner.
Okay.
But I'd like to mention for pregnant women
Yes.
to be particularly aware of any fever, flu-like illness and diarrhea in pregnancy.
Yeah.
They may not feel that it's that severe, but often it will lead to the bacteria getting into the bloodstream and being transmitted to the baby in the womb.
Act fast. It is preventable. It is preventable. That's the key that we need to get out there. And yet it seems to be a big problem in South Africa. But I think your advice has been incredible. Thank you, Dr. Juno Thomas, who is the head for the Center of Enteric Diseases at the National Institute for Communicable Diseases. All right, we're going to take a break. And then